Hi, my name is Aubrey Lisicki. I'm a licensed massage therapist, teacher, and writer here in Seattle, Washington. I consider myself a mammarologist. I obtained a certificate in clinical massage from the Soma Institute in Chicago. Since receiving my certificate, I've also studied oncology massage, lactation, breast massage for surgical breast, lymphedema therapy, and lymphatic drainage. In particular, I studied breast massage with nurse and massage therapist Cheryl Chapman. Cheryl Chapman is also the author of a wonderful book, The Happy Breast Book. My interest in breast health began in 1996 when I was hosting an alternative medicine talk show and I interviewed an author named Leanne Chlorfine-Caston. Leanne wrote a book called Breast Cancer, Poisons, Profits, and Prevention. This book opened my eyes about the opportunity that we have as women to affect or discourage the development of breast cancer in ourselves. I had originally thought that our only option was to rely on our genetics and keep our fingers crossed, but there's a lot that we can do for ourselves to help prevent breast cancer. So that's why I put these lectures together, so that I might help you either for yourself or for your clients as a massage therapist yourself, share some education and spread the good word. In my studies and the development of my breast massage and breast care materials, it has become very apparent for me that in the 21st century, we really need to move ahead from breast cancer detection to breast cancer prevention. There are a lot of studies and a lot of information available to women so they can make healthy lifestyle choices to help improve their breast health naturally and not be so dependent on high-tech machines and gadgets that are very expensive. So in our talk today, we will share some information about things women can do for themselves or things that massage therapists can share with their clients to educate them about what they can do for their own breast care in between doctor's visits. I do have to share with you an important disclaimer. I am not a doctor, and breast massage does not replace medical care. It is important for you to realize that if you have any questions or concerns about your breasts, you need to consult with a physician about these issues. Breast massage is not a cure for cancer. Instead, it is a very important part of an integrative medicine approach to breast health maintenance as well as breast cancer treatment. So what is the problem we're facing in Western society today? We have women who are afraid of their breasts and afraid to touch their breasts. They're afraid of cancer. If they do find something during a breast self-check, they don't know who to ask or where to get more information. And they're not sure if they're doing a thorough breast self-check in the first place. So our lecture today will have 3 parts. The first part is to discuss the breast anatomy, so that you have an educated touch when you examine your breasts and how to discuss this with your doctor. We'll also demonstrate a breast self-massage technique that you can do for yourself at home, or as a massage therapist, you can teach your client to do for themselves. In part 2, we will meet Gina, and Gina has a scenario that is very common to many women in Western society. She's gone to her doctor and the doctor has found a lump. It's questionable, it's suspicious, it's not clear if it's cancer or benign. They're not sure and they've asked her to return in 6 weeks to be imaged again. What is something that Gina can do to help her own breast health in the interim before the follow-up visit? Or what is something that a massage therapist can teach Gina so that she is better educated when she returns to the doctor in follow-up? So we'll review Gina's story and ways that you can learn to interact with your physician and ask questions and be proactive about your breast cancer screening. In part 3, we'll learn how to optimize our best breast cancer detectors, our own hands. Studies show that women are most likely to find their own tumors and bring them to the attention of their doctors. So how do we do a thorough breast self-check? We'll explore the techniques to use and what process to utilize in order to be the most accurate with your own breast self-check. Massage therapists will appreciate that there is a science behind learning how to palpate breast tissue effectively and accurately. So now let's discuss that the breast is an organ. Women are so amazing. We grow an entire organ on the front of our bodies during adolescence. The breast is made up of mammary glands, fat, lymph vessels, blood supply, and nerve supply. We owe most of the information that we know about breast anatomy to Sir Astley Cooper. He was a physician in the beginning of the 19th century, and due to his extensive dissections and detailed anatomical drawings, we know a lot more about the breast anatomy than we did previously. Unfortunately, in the last 100 years since his research and discoveries, the medical establishment has not seen fit to do further research in detailed breast anatomy. Surprisingly, we owe our most recent findings to the specialty of plastic surgery, as the surgeons want to be able to provide the best possible outcomes and appearance for their clients. So now let's draw a breast so that we have some idea what we'll be discussing and what you'll be feeling under your fingers. The upper border of the breast extends to the clavicle or the collarbone. The medial border reaches to the breastbone or the sternum. The lower border in some women reaches to the 6th or 7th rib. And on the outside of the body, it will reach all the way to the axilla or underarm. The breast tissue lies over the pectoralis major muscle, and it also lies over serratus anterior on the side of the ribs. There are many lymph vessels in the breast tissue, and these extend to lymph nodes that are in the underarm. The nipple and the areola are in the center of the breast, and the mammary glands are little clusters of grapes with long ducts that extend to the nipple. Now let's discuss these structures in more detail. The breast is considered to be part of the integumentary system, or the skin system. Despite this fact, dermatologists are not in charge of breast health and breast care. Some women may go to their primary care doctor or to a gynecologist to discuss their breast health. If they have problems with lactation, they might see a lactation consultant. If they're concerned with the structure or size of their breast, they'll see a plastic surgeon. And if they develop cancer, they will see an oncologist. Unfortunately, there is no field of mammorology where a woman can go to one doctor to discuss the health of her breasts throughout her life. Mammary glands develop in the fetus from sweat glands. Depending on the hormonal development of the baby, over time, these sweat glands develop into mammary glands, which will grow into a breast in adolescence. As we've discussed before, the breast tissue rests on top of the pectoralis major muscle, and so has no intrinsic muscles within the breast tissue. There are glands around the areola. These bumpy glands are considered Montgomery glands, and the ducts from the mammary glands converge to meet behind the nipple. The mammary glands are broken into 12 to 20 lobes and divided by ligaments, which are considered Cooper's ligaments, after Sir Astley that we discussed previously. There are many lymph vessels within the breast tissue, and these are responsible for drainage of fluid from the breast to the underarm. In the underarm, there are many lymph nodes, and this is the area that doctors will look for sentinel nodes in if a woman has a lump that is found to be cancerous. Husband and wife team Sydney Ross Singer and Soma Grismeyer have written a controversial book, Dressed to Kill: The Connection Between Breast Cancer and Bras. This book started when Soma, during her pregnancy, found a lump. There was concern about how to go through with further investigation of this lump, as many of the tests that needed to be run would cause harm to the fetus. Soma and Sydney decided to investigate other ways that they might promote breast health without harming their baby. They were able to perform a study where they compared the bra-wearing habits of women with breast cancer and the habits of women without breast cancer. And they were able to find a correlation where women who spent more time in bras or women who wore tighter bras were more likely to have breast cancer than those who didn't. This, of course, was not seen well by the fashion industry, and there have been many interviews on television that have spoken to how breast cancer is not caused by bra wearing. This study was not a causation study and only shows that there's a correlation that women might want to think about or needs further investigation. Why does bra wearing affect breasts? Because of the lymph vessels that we discussed previously, there is a lot of fluid that accumulates in the breast. Since there are no muscles within the breast tissue to pump this fluid away, we need to rely on natural motion and activity throughout our day. In Western society, since we wear bras over our breasts to compress and reduce this motion, we can get a buildup of stagnant fluid. Well, what is lymph fluid? Lymph fluid is the water that leaks out of the blood vessels and is released from the cells when they excrete their metabolites and waste products. This fluid gets brought by the lymph vessels back in through the lymph nodes to be filtered, and then reaches back into the circulation to be excreted. As you can imagine, if we were to allow this fluid to build up in an area with these excessive cellular waste products, it would be very unhealthy to the tissue. This buildup of cellular debris can restrict the flow of fluids and make it so that we cannot bring healthy nutrients in to feed the cells. Wearing compressive constricting bras over our breasts reduce the natural motion that would help the breasts drain this fluid out on their own. So, what is another way to move these fluids? Breast self-massage is another way to improve your breast health and to promote the circulation of the breast fluid. Another great resource is the book by journalist Florence Williams, titled Breasts: A Natural and Unnatural History. Florence Williams started investigating the history of breast surgeries and the research behind breast health after she had her first baby because she was concerned about the health of her child from lactation and what might be coming through her breast milk. This book is an excellent way for women to see how their environment, both external environment and internal environment, affects the health of the breast and can affect the constituents of the breast milk for their babies. She also discusses the history of breast surgery as well as the development of breast cancer treatments over time. She shares with the reader how she developed a healthier lifestyle. These things include changes in diet, especially an increase in vitamin D and iodine, adding exercise, and avoiding pesticides and other petrochemicals in your environment and in your home. Now we'll move to a demonstration of breast self-massage. This is an easy thing that women can do for themselves every day, or that a massage therapist might teach a client to do as part of a session. This breast self-massage is a very important way to reduce pain, swelling, and tenderness in the breasts, particularly around the time of your period. If a woman is noted to have fibrocystic breasts or dense breasts, this can also improve the texture of the breast over time. Today, we're going to learn the FAST technique. And I call it the FAST technique because it's a quick way for you to do breast self-massage at the end of your day, maybe after you take off your bra or perhaps in the shower. So FAST is spelled P-H-A-S-T. And it's a great way to improve the breast circulation as well as improve the quality of the tissue texture. So we'll start with P, and P is for pump, and we're wanting to pump the lymph fluid from the underarm so that the breast has better circulation. So we'll start by crossing our arms over to the opposite armpit, and then we will gently press the hand toward the chest wall while we're dropping the arm. So these compressions are to move the lymphatic fluid out of the underarm, and we'll do that about 5 times. Every time we press and release to allow the fluids to move through the tissues. So after we do that, we're going to move to H. H is for honk, like honk the horn. And we're going to be working on the deep fluids at the back of the breast wall. So we can cross our hand over again, and we'll be compressing the breast tissues directly back into the chest wall, remembering to do all the areas of the breast. The breast tissue goes all the way to the side of our bodies, and we can do those pressures about 5 times, similar to how we did the pump. Next, we'll be moving on to A. A is for around, like around the clock. This time we'll be using a lighter touch and moving the superficial blood supply and stimulating the nerve endings. So we will circle our hand around the perimeter of the breast, making sure that we get all the way around the edges. And after we do a few circles in one direction, we'll reverse the circles so that we're going clockwise as well as counterclockwise. Wonderful. The next letter is S. S is for support and slide. We'll start by putting our hands underneath the breast, using both hands to support the breast, and then sliding the breast from side to side in order to relax and loosen that deep fascial tissue. And after we do several slides to each side, we'll also lift the breast toward the shoulder and then let it drop to loosen up that fascia at the back of the chest wall. After that, the last letter is T, and T is for twist. The twisting motion will loosen the fascia around the mammary glands, and for this motion we're doing a vertical compression. So we'll have the hand on the same side underneath the breast and have the opposite hand over the top. We're pressing the tissues together and then twisting them in opposite directions. So we'll be twisting, remembering to do the outside and inside of the tissue as well as the top and bottom. So after we twist several times one way, we can reverse our hands and twist the other way. This is a great way to release the fascia around the mammary glands. And we like our magic number 5. That's usually a good amount. And if we choose to, we can close the session by doing a few pumps in the underarm. That way we know we've moved all the fluid out of the breast and through the arm back into the circulation. So that's the fast technique. P for pump, H for honk, A for round, S for support and slide, and T for twist. This is a great way to improve the circulation of the breast and also the quality of the tissue texture. And it is a nice thing to do at the end of your day after you take off your bra or when you're taking your shower. This concludes part 1 of our lecture. In part 2, we will discuss a common scenario for many women in our society, where a doctor finds a lump in a breast exam and the woman would like to know, what should I do now? If you are interested in learning more about breast care and therapeutic breast massage, I teach continuing education classes and am available for public speaking engagements, as well as private breast care education sessions. You can reach me at www.breastremediseattle.com.